Today on The Cone, we're talking about 5 questions you can ask to make sure that your furry family members are as safe as possible if they have to go under anesthesia. Let's go.
And now, the vet who treats the sheep you count in your sleep, Dr. Andy E. Roark.
Sometimes pets need to go under anesthesia to have a procedure done or a surgery or to get their teeth cleaned. Today on The Cone, I'm giving you 5 questions that you should ask your vet to make sure your furry family member is as safe as possible. Let's go. I'm not going to tell you that anesthesia doesn't have any risks. However, the way anesthesia is done between vet practices varies widely. I'm going to give you 5 questions that you can ask your vet to make sure your fur baby is going to be as safe as possible. Ask them what tests they will do. For me, doing blood work before anesthesia always makes sense regardless of the pet's age. And if your pet faints at the sight of blood, you might not need anesthesia.
Really?
No, that's not true. Blood work can help keep your pet safe in 2 ways. Number 1, it allows us to catch diseases that are early or mild, but that could still cause real problems under anesthesia. I'm talking about diseases like diabetes, hyperthyroidism, or kidney disease.
I had to have one of my kidneys removed.
Why?
I needed the money. So many parking tickets.
And number 2, it gives your vet an overview of how your pet's body is working internally. I'm particularly interested in what the immune system looks like, if the blood will clot so we don't have excessive bleeding, and I want to make sure the liver and kidneys look good since those are the organs that will be handling the anesthesia drugs.
What does a good liver or kidney look like?
It's got a halo and it sparkles.
Really?
No. If your pet is a senior pet, and senior varies with the species, the breed, and the size, then a more complete blood panel might make sense. Older pets are more likely to have diseases that affect their organs. Younger pets are more likely to have diseases that affect their electric guitars. Depending on the case, or if your pet has previous medical history, or if your pet is of a breed that's at risk for some specific conditions, your vet may recommend further testing. Remember, it's up to you to decide whether or not you want to do these tests. No matter what, make sure you know what tests are recommended and why. Who will be watching your pet? Many vet practices now have a technician or nurse whose sole job is to monitor patients while they're under anesthesia. This person is not helping with the procedure, they are only watching to make sure pets are safe. Ask your vet clinic if they have this person. What monitors will they use? What will your vet team be paying attention to during the surgery, and why? If my pet is going under anesthesia, I want someone watching his blood pressure, his body temperature, and his breathing. I'm also going to hook up an EKG to look at the electrical activity in his heart, and I'll be watching his CO2 as well as his oxygen levels. If you like watching oxygen, check with your local cable provider. What should I expect during recovery? You can expect that your pet will feel like Kesha on Monday morning. Some surgeries only require a very short recovery time, others take much longer. Your vet should be able to give you an idea of what to expect. Also, some pets after anesthesia are going to be wobbly and unstable and unable to go up and down stairs very well, also like Kesha. If your pet sleeps upstairs, we either need to set up a recovery area on the main level of your house so that they can be comfortable, or we need to be prepared to carry them up and down the stairs. Almost every surgical or dental procedure will have some associated level of discomfort. Talk to your veterinarian about what level of pain to expect and how the pain is going to be treated, because pain is not okay.
That's not what Christian said to Anastasia.
Talk with your doctor about the need for physical therapy. After surgeries, oftentimes things like hydrotherapy, massage, range of motion exercises, acupuncture, or laser therapy can do wonders in speeding the recovery process. Also, many pain medications have to be given by mouth. If you have difficulty giving your dog or cat a pill, let your vet know that. Ask for other options because we need to make sure that our pets are comfortable. There are even some medications now that can be given by belly rub.
Really?
No. Thank you so much for watching. Please help me to help pets by subscribing to this channel and telling your friends about the Cone of Shame. Also, If there's topics you'd like to see me cover, just tell me about them in the comment section below. That would be awesome. Until we meet again, let's be the people that our pets deserve.